Kia ora and welcome to No ME, the podcast video series where guest speakers talk about pressing issues surrounding myalgic encephalomyelitis, chronic fatigue syndrome, and long COVID. Join researchers, clinicians, and patient advocates as we take a deep dive into the most recent evidence-based information so that you too can know ME. ANZMES does not benefit from or receive any funds from any courses or products mentioned in this podcast episode. ANZMES does not provide medical advice directly to patients. Please always seek professional medical advice. This podcast is intended for health professionals seeking information on how to help patients with these conditions. In today's episode, we will discuss symptom management for mild to moderate myalgic encephalomyelitis and long COVID. We're joined today by Tessa Nielsen and Dr. Eleanor Stein. Tessa Nielsen is an exercise physiologist dedicated to the field of chronic illness. Tessa completed her master's degree at Massey University in 2017. Her research focused specifically on chronic fatigue and post-exertional malaise. Currently, Tessa holds a position at Specialized Health, a company operating in the insurance sector. Their primary goal is to assist individuals facing chronic health challenges to reclaim their lives by helping them return to work and life. Dr. Eleanor Stein is both a person with lived experience and a healthcare professional. She retired from medical practice on December 31st, 2022 to focus on her passion to provide science-based information on ME/CFS, fibromyalgia, environmental sensitivities, long COVID, and chronic pain to anyone worldwide wanting to take charge of their health and improve their quality of life. Ellie became ill with ME/CFS, fibromyalgia, and environmental sensitivities in 1989. Since then, she learned that she has the full alphabet of related conditions, including joint hypermobility, orthostatic dysfunction, and mast cell activation syndrome. Now she passes on what she has learned about these conditions over the past 33 years to make the patient journey to healing easier and faster. Kia ora and welcome. Haere mai. Thank you both for being here today.
Thank you.
Thank you.
So people with ME/CFS and long COVID learn very quickly that activity can cause a worsening of their symptoms, known as post-exertional malaise or PEM. Tessa, while you were studying with Dr. Lynette Hodges at Massey University, what did you learn about post-exertional malaise?
Feels like it was just yesterday, but it was a few years ago now. So I did have to go back and read my discussion to nut out some details. But what we were looking at in our research is basically some physiological signs of PEM. So what's going on in the body when people are experiencing that? And then we also wanted to get some subjective information from people. So if we make people exercise, people with chronic fatigue, how does that affect them? Most people know if you've got chronic fatigue, you know, but there wasn't a lot in the research at that time. So what we found, unsurprisingly, is that there is no identifiable trend, which makes it very difficult. But we basically found that everybody that we put through an exercise protocol responded differently. Some people recovered within 3 days, other people took up to 20 days to recover. The only trend we noticed is that the people who went through a protocol that was they had less time in between. So if they did a session and then they did one 24 hours later or 48 hours later, their PEM lasted a lot longer than if they separated those sessions out. So that was the only trend we really identified, that if you leave more time between bouts of exertion, then you will recover faster. But other than that, very different based on every single individual.
That's the thing, it is a highly individualized condition, and that's what can flummox a lot of health professionals when they see patients and presenting with different symptoms. But that post-exertional malaise, I think, is the cardinal characteristic. So it is the one that is most commonly experienced. And I think that is you, Ellie, you've probably experienced that with in your practice as well, that the type of activity that a person does will depend on how much post-exertional malaise they experience and how long it takes to recover.
And what Tessa just described really fits with, what I have seen clinically, and it's probably related to the findings we have on something called the 2-day CPET. So if you put people through a cardiopulmonary exercise test where you're on a bike and it's getting gradually harder and harder, and the experimenter or tester says, keep going, keep going, keep going, and you keep going until you're exhausted. So that's called testing to exhaustion. Most people with ME/CFS are kind of equal to other people who are, we'll say, deconditioned or in less good shape on the first day of the 2-day test. And so that's been very problematic, because it's led some people to say, well, they're just like this because they're out of shape. But the significant finding is when you do the test again 24 hours later, so kind of like what Tess is saying, if you do it 2 days in a row where the cellular energy hasn't recovered, then on the second day, even though the subjects are trying just as hard, and we can measure that objectively, it's very hard, hardcore science, they don't do as much work. They can't stay as long on the bike, and they can't, pedal as fast. So one of the core pacing strategies that I teach people is called chunking, meaning break things into small bits that won't get close to exhaustion and that you can recover from faster before you kind of start the next bit.
It's so important. It's a very hard thing for patients to do as well when, you have, just like healthy people, you have lots of commitments. There's people with ME who have children and spouses that they were trying to work, but maybe had to give up the work. There's always something to do. So it is very hard to pace, and it's an art form, I think, for people to learn.
It definitely is. And it takes a little bit of coaching and cheerleading on the part of the healthcare professional to explain to people, if you can do 1 or 2 or 3, depending on your health level, of little chunks of activity every day, and rest in between and recover so that you don't have a big crash. Like Tessa was saying, if you crash and it takes you 20 days to recover, that's 20 days doing no chunks, right? So people kind of get it, that if they can do a few chunks every day, in the long run, they're actually going to be more productive than if they work way above their exercise or energy envelope, and then they crash and take a week or 3 weeks to recover.
Exactly. So is that what you speak about when you talk about the Goldilocks zone for post-exertional malaise?
Oh no, the Goldilocks zone. Sorry, I'm just getting hot here. The Goldilocks zone is something a little bit different. So it is kind of saying, if you think back to Goldilocks, she went into the houses of the 3 bears and tried the beds, and one was too hard and one was too soft and one was just right. So it's kind of like that. It's if you're trying to find your own energy envelope. If you do too much activity, you're going to get post-exertional malaise. You're going to be out for the count. It's going to affect not only your ability to do physical activity, but also mental and emotional activity. It affects everything. All your symptoms get worse, right? So often it takes people to bed and they're totally out of commission. On the other hand, and this is the really tricky part, if you don't do anything, so some people, and I have to say they're not in the majority, but some people get really cautious, right? And they just are so scared of a crash, they really pull back. Then what happens biologically is that your body systems become less capable. So it's kind of a use it or lose it in the body. If the body works optimally when we're stressing it, just enough, not enough to damage, but enough to challenge. And so when I talk about the Goldilocks zone, I'm kind of saying you have to do not too much or you're going to crash. And that's clearly counterproductive, physically and emotionally, because it's so discouraging. But if you don't do anything, even if that's the right choice for you because you're so severely ill that you truly can't do almost anything, like there's some people just talking or being on their phone for 1 minute is enough to put them in a crash. So it's not saying people are making the wrong decision and could be doing better, right? But because for some people, their illness severity is such that they have to pull back so drastically, unfortunately, it makes it harder to recover in the long run, I would say, because all of the body systems are kind of becoming less efficient and effective. So that concept is called hormesis, and it's kind of a fancy word, but it refers to the fact that if you push your body a little bit with hot, with cold, with fasting, with exercise, there's a whole bunch of ways of doing it. It will challenge your cells and help keep them fit. So for people that can't exercise because they have severe post-exertional malaise, sometimes they can use other strategies. And the beauty of hormesis is that different strategies have a common endpoint. So say you do cold exposure and heat exposure, believe it or not, they achieve some of the same goals at the cellular level. So I think hormesis is a useful concept for people whose exercise tolerance is really limited. There may be other ways they can challenge their cells and their body to stay a little bit in shape.
That's great. I guess we talk about some of the more simple things that people can try, like the Tai Chi, because it's just the movement, getting the muscles moving, but not overextending. So I just thought we'd talk a little bit about some of the overlapping symptoms that people experience, just so our listeners and viewers can understand that a little bit. Ellie, what are the more common overlapping symptoms for people with ME and long COVID, and how do they differ, those two conditions?
Yeah, so my understanding, and of course there's tens of, maybe hundreds of thousands of papers out there now on long COVID, but the studies I've read show that about 50% of people have long-term effects that are due to the severity of their illness. So they have lung problems, heart problems, problems from having been in intensive care, kidney problems, things like that. And about the other half of people with long COVID have symptoms that are virtually indistinguishable from the symptoms of ME. And the most common ones include post-exertional malaise that we've just been talking about, where if you overdo it in any way, and overdo it, I put in quotes because, of course, for a healthy person, it wouldn't be overdoing at all, right? That you overdo it, you end up in a prolonged crash. And then there's brain fog, cognitive dysfunction, not being able to think clearly and concentrate. There's often chronic pain, usually muscle and joint pain. There's unrefreshing sleep. And then there's autonomic symptoms. So many people have low blood pressure, high heart rate, and difficulty remaining upright. There's loss of stress tolerance. So people have difficulty managing things that they used to manage easily before. And then there's increased sensitivities. So sensitivities to chemicals, to electricity, to cell phones, to smells, to taste, to vibration, to movement. So all of those things are seen pretty equally in people, this half of people with long COVID who have the ME type picture. And a lot of research at the cellular level is also hinting that they look very similar, which if you think about it makes total sense because ME is a post-viral syndrome. So COVID is just one virus. And we know that there's, or I'll say a post-infectious syndrome because not all the infections are viruses. It makes sense, right? The body has only so many ways to respond to infections, and this seems to be one of them.
Yeah, exactly. Yeah. And with ME, we know that there's a few triggers. It can be a virus, it can be a bacterial infection, it can be, a physical trauma like an accident or untreated back injury. It can be emotional trauma as well, can't it? And as you've mentioned, environmental sensitivities and toxins, exposure to fertilizers out on a farm, things like that have all these things have caused ME. So it makes it a more complicated condition as opposed to long COVID, which has just one trigger, which I think is what's caused some of the confusion around ME and how to treat it, how to manage symptoms. Tessa, given the types of symptoms that are happening in ME and long COVID, and in particular with the post-exertional malaise that we've been talking about, and fatigue being the most debilitating symptoms that occur, how can you as an exercise physiologist help people with ME and long COVID?
Yeah, so I guess the title exercise physiologist is often not very comforting for people with chronic fatigue. The word exercise often sort of scares people off, but we actually spent a whole staff meeting at one point trying to decide what a better name for ourselves would be, but we've decided to stick with it. But we focus more on activity, right? So exercise and activity, we sort of use the terms interchangeably, but what might be, you know, a 3K walk for one person might be hanging out the washing for another person. So activity covers all sorts of things. But the main thing we do, which Eleanor has spoken lots about, is all about pacing and task scheduling in relation to that energy envelope. So the first thing we do with clients is figure out what the energy envelope is, because everybody's is different. Some people will, like Eleanor discussed, really have severe PEM after a 5-minute phone call, whereas others, it takes them a little bit longer. So the first few weeks, we're actually just determining what somebody's energy envelope is. And then we start to educate them on how to plan their days and their weeks in relation to what they are able to manage at that time. And then once we've sort of got them at a place where they're not experiencing post-exertional malaise, we can start to slowly add things as the energy envelope expands. One of the tools that we use, which I really like, is rainbow task scheduling. I'm not a huge fan of the term, but it's basically sitting down with somebody and looking at their week and deciding what tasks are the most challenging for you, because everybody's so different. For some people, it'll be the physical tasks. For others, it'll be the cognitive tasks. And then there's people who really struggle with the social side of things. So yeah, figuring out where everybody's at is the first step. And then once they're sort of in a bit of a rhythm, we can start to push that energy envelope a little bit more. But yeah, we deal with activity when it comes to chronic fatigue opposed to exercise. Yeah.
And I guess that's with writing down as well what the activities are, sort of doing a symptom diary as well.
Yes.
Would you be doing
definitely.
that? Yeah. So you have the Bounce program at Specialised Health. Who is that for?
Well, it's for anybody experiencing chronic fatigue, which is why I use the term chronic fatigue. So it also includes people with post-viral fatigue, so long COVID, people with cancer who have been experiencing chronic fatigue, often people with chronic pain, they start to develop chronic fatigue as well. So yeah, we work with a lot of different conditions, anybody experiencing chronic fatigue. I guess the tricky thing is that because we work in the insurance space, it's only available to people who have health insurance or income protection insurance, because their insurance company pays, and it's not very cost effective for individuals. But I'm hoping as this as the knowledge increases, so exactly what you're doing with your organization, we can get more private providers who can give these types of programs to individuals. But right now, yeah, we are working in the insurance space. So if people have income protection and they've had to come off work, we get the opportunity to work with them, which is really, really cool.
Absolutely. And so what are the NICE guidelines that your program follows?
So I guess I just sort of covered that as far as the energy envelope goes. So that's the big thing that we work with, is the energy envelope. So pacing, task scheduling, rest. So like what Eleanor said with the chunks. And I guess the big thing is we don't do graded exercise therapy, which is what previous recommendations were all about. We were sort of a little bit ahead of the NICE guidelines anyway. It's sort of obvious when you work with somebody who's got chronic fatigue that graded exercise doesn't work like it does for other individuals. So we were already doing these things. The other thing that we do, which I don't know if many people do it and they're just not as transparent, but we use heart rate variability as a tool. And in the NICE guidelines, it does say that digital biometric tools could be useful. So we've been using heart rate variability in this space for a long time, which in practical sense just involves our clients checking their heart rate variability in the morning and using that as a guide as to how their body is dealing with stress. So we're talking about the energy envelope. Are we pushing it too far? Or like Eleanor mentioned, are we not pushing it far enough? So we can actually see where they're sitting as far as parasympathetic and sympathetic nervous system activity goes using that tool. So that's a big one that we use, along with all of the basics in the NICE guidelines around pacing, etc.
And I assume that it's individualized as well, the heart rate variability. So it's really personal to the patient and what exertion causes a heart rate increase for them and what would be considered too much or overexertion.
Yeah, and I think the main thing that heart rate variability does is it provides some validation for people as well. Subjective symptoms are great, but if somebody's, telling you that they are feeling a certain way and then they've got this data that they wake up and they say, oh yeah, wow, no wonder I'm feeling like that. I think that's a big part of HRV is just saying, not only do you subjectively feel this way, but yes, your body is currently struggling with stress. So that's a huge thing that heart rate variability does. But yeah, very individualized as well, 100%.
And that's important, particularly with ME, is to validate the illness as a real physiological disease, showing the manifestations that are occurring physiologically. So Ellie, you were actually diagnosed with ME/CFS over 30 years ago, but now you seem to be able to live quite an active life, which is amazing. I know that you recently retired from practice to focus on your teaching, but you have been doing your practice and conducting research, and I see that recently you've been going on hikes, which is generally more than most people with our conditions can cope with. So would you like to tell us a bit more about your journey with wellness?
Yeah, I'm very, very familiar with post-exertional malaise. So for many years, I loved physical activity. I was always, athletic and super active my whole life until I became ill. And then after that, it just grinds to a halt. Every time you do something, and it takes weeks to recover. It's kind of soul destroying and discouraging. And I really became good at pacing. So to be able to do things in little chunks. Mm-hmm. And then in 2017, I just unexpectedly had a very big uptick in health. And of course, many people ask me, what do I think contributed to that health? So I would say a few things. One is just overall self-management. So I teach self-management. That's now my passion. I have an online course. So everything I teach in the course. And one of the big things is charting or self-awareness. So I was really happy to hear Tessa say, she starts by helping people figure out where they're at. Because until you know where you're at, you have no way to, make a sensible plan, right, for your day or your week. So I do all of everything I teach, I walk the walk. But then for me personally, and this might not be true, for everybody or for even many people, I made a big diet change. And I have other health conditions in addition to ME. I'm one of these lucky people. And I think they're also immune or inflammatory based. And when I went on, it's called the paleo autoimmune diet. So it's a diet that tries to decrease your intake of foods that irritate or activate the immune system. And also around the same time, I was actively practicing neuroplasticity, learning how to calm my nervous system. I'll say be more optimistic. I'm not an innately optimistic person. And you can imagine after 27 years of illness, any little optimism you have gets kind of worn away. So I've really worked on my mindset to realize the brain is incredibly powerful, and I actually do have more control than I think. So basically all of the stuff that that's why I'm so passionate about trying to pass on that information. So for me, I think it was a combination of years of really careful self-management and getting to know my capacities and limitations, the diet change, and then neuroplastic practice. And that was in 2017. So that's 6 years ago. I'll be coming up to 6 years in September. And as long as I stick to that, I continue to do well. Mm-hmm. And every time I rest on my laurels, I recently did a little short video that's on my YouTube page called Resting on Your Laurel, or Self-Management is for Life. And I talk about the pitfalls of resting on your laurels and thinking, oh, I can eat a little bit of this and a little bit of that, and I can stay up late, and I don't have to wear my blue blocking glasses because I left them in the other room. And, all of those kind of slipping off the bandwagon behaviors get me back to where I started. So I wouldn't say I'm cured, but I would say I've found a good self-management protocol that works for me. And I believe if it's possible for me after 27 years, it's possible for many people. So I say, don't give up, keep learning more strategies, try them, record whether they work or not, keep the things that work, ditch the rest, and then try adding a few more things until you get that perfect mix. Having said that, and maybe it, kind of in response to what Tessa was sharing, it's also a sad reality that not everyone can improve. So even if, you figure out your energy envelope, you're working with an expert like Tessa, who's very knowledgeable and is giving you these little baby step increments, some people just don't get better, and we don't really know why. Many people can get a little bit better or even a lot better, but some people just don't. And if you're one of those people that every time you push a little tiny bit, you slip back, means your Goldilocks zone is, got to be reimagined.
Yeah, absolutely.
And I'm just saying that because, sorry to cut in, I don't want people to feel guilty or bad or a failure if they don't improve. It's not that you've done anything wrong. It's just that this is a serious biomedical disease. And unfortunately, we don't have all the answers.
Exactly. And that's really important to say. We can try all these things, but if they don't work, it is the way it is. And we are still learning. There's still, there's a lot more research out there now as a result of long COVID as well, just trying to get down to the cellular level, trying to figure it out and trying to find out what we can do to reverse damage or fix the dysfunctions that are going on. So there's still hope, even for those with very severe ME or those who have such a very small window of energy, that we will at some point find something in the research that can be brought in commercially as a treatment. So you talked a little bit about neuroplasticity. Do you want to just sort of explain that for people who aren't familiar with the term,
Sure.
What it sort of, traditionally involved with?
So neuroplasticity basically means that the brain, the neuron is the name for the cells that make up the brain. The neurons connect with many other neurons. So there's 100 billion neurons in the brain, and each one has connections with 10,000 other neurons. I mean, it's incredibly complex. Every time we think, feel, or do something, new neural connections are made. And the more we repeat and practice something, those neural connections get stronger and stronger, because the brain loves efficiency. So it loves when it can put something on autopilot and just say, yep, we've got that down. The problem is that when we're ill, what the brain has learned is often not optimal. And so neuroplasticity practice is doing specific practices that rewire the brain to be more aligned with our goals and objectives for health.
And so what kind of how does that work? So what kind of practices would you be doing in neuroplasticity for health?
Okay, so it's a little bit, it's a little bit complicated. I have a whole course on that, but to try to drill down, the fundamental strategy that I teach is called active redirection. So what that means is every time I become aware of a symptom or a habit that I'm trying to change, because this works for habits as well, say tendencies or addictions or ways of thinking or being maybe that we don't like and we want to be in a different way. So it's very, very broad. But whenever I become aware of the symptom or habit that I'm trying to change, I actively redirect. I make a decision in that moment to focus my attention not on the problem, but on a solution. The solution could be almost any activity that makes me feel good, that elevates my mood, makes me feel safe, calm, connected. When I feel safe, calm, and connected, right, my autonomic nervous system relaxes and a whole bunch of different neurotransmitters are produced, the neurotransmitters of health and connection, rather than the neurotransmitters of fight and flight, fear, adrenaline, cortisol. So by changing our mental experience, we actually change our biology. And if we do that often enough, we change our biology and we change the neural pathways, and we can literally heal from things like, I would say most commonly, chronic pain and sensitivity symptoms. So multiple chemical sensitivity responds very well to this approach. Chronic pain, which we know is primarily a disorder of the brain. The brain has become scared and oversensitive to the signals that are coming in, and it misinterprets them as being dangerous, and it fires up pain. We can really dramatically decrease those kind of symptoms with neuroplastic practice.
That's amazing. So tell us a little bit about your course, actually. So you do have a course on neuroplasticity, just so people can understand what's involved in that course.
Yeah, so the course has 9 modules. I'm actually literally just today in the process of putting a 10th module up there on actually how to practice, to try to kind of streamline it and explain exactly what people need to do right from the beginning. But of course, I explain what neuroplasticity is. I explain how it's connected to the symptoms, because I think if people it's a bit sciencey, but if people understand the science, they're going to buy in and they're going to go, oh, I get it. This could really work for me. It's not magic, right? It's science. I talk about calming the brain, because the brain, basically pain and other sensitivity symptoms are as a result of the danger system in the brain being continually set off. So it's like an alarm system: pain, danger, danger, do something. So I teach people ways of calming their brain, ways of feeling safe, because that's like the opposite of danger. I teach them the active redirection strategy, and then ways of connecting the mind and the body, ways of connecting their thinking. So everything has to be aligned for the best outcome, right? You have to have the mind and the body working together. And then strategies to start getting their life back, because you can improve all your symptoms, but that's not enough to get your life back. Then many people have been out of life for years. Now they have to actually kind of make a plan and make, slow steps to regain kind of the relationships and the activities that they enjoyed. So it's a self-study. You can sign up at any time, work totally at your own pace. And that's to try to accommodate people that are severely ill, that maybe, like, I recommend doing each module over 2 weeks, but you could do it over 2 months, right? If that's what you can manage. And it kind of walks you through step by step all of the major components that will help. There's the neuroplasticity, changing your behavior, changing your habits, but then I call that like the center of the flower. Then there's all the petals around it that make it work better. So learning to align your thinking, learning physical strategies to assist your brain, the calming, the safety, all of those things make the neuroplasticity more effective.
And I think that's really important because we know with people with ME, CFS, there's some research that's come out of Otago University, Professor Warren Tate, where he's showing how ME is sustained and how the relapses occur. And it's basically showing chronic inflammation, but it's getting stuck in the HPA axis. So, you know, it's getting stuck in that loop. People can be stuck in the fight or flight response, thinking that there's danger when there isn't. And that's a physiological thing, not a psychological thing as well, which is important to make that distinction. But we know with the brain, you know, when they do MRIs on, say, violinists, they see that the motor cortex of the brain has way more neural connections, right, because of that practice every day. So we know that it happens, and that if you don't, like you said before, if you don't use it, you lose it. So there is that pruning that goes on in the brain. So you can prune away those limited beliefs or the things that aren't working anymore and strengthen the things that do work, and that those calming strategies. So it is so important.
I may just make one point, because you kind of hinted at it, it's so important, is that because I know out in the bigger community, there's a lot of people that feel that using neuroplasticity as a tool is somehow an invalidation of the biomedical reality, right? All of the biomedical findings, of which there's, you know, thousands of papers written. It's not at all. It's just a tool that if we change our brain consistently to a less danger state, it's going to have an impact on the body. So it's not in any way saying that these aren't real diseases. They absolutely are. But the brain, we can't change our body very easily. We don't have a lot of tools, but we have a lot of influence over our brain and our mental function. So it's just a tool. It's a way in.
Absolutely. And so you have a course called Pathways to Improvement as well. Do you want to tell us just a little bit more about that?
Sure. So Pathways to Improvement is really my core course, like everything I've, you know, learned myself and taught to my patients over the last 35 years. That's scary to even think about. So it's all about self-management. So it's I have a mind-body session right at the beginning, teaching about neuroplasticity, epigenetics, and the microbiome. So how we can really leverage our biology by simple changes in lifestyle. Then I go through diagnosis. Many people maybe don't have access to a healthcare professional who's very sure what they have. So this will help people make sure they're in the right box. I talk about sleep, activity. So a lot of the stuff we talked about today, diet, decreasing exposure to environmental toxins, managing mood, and managing pain. So those are kind of the main symptom areas. So I just go through them one by one. There's one module for each of these symptoms, and I give a whole bunch of strategies because, like you said at the very beginning, Fiona, we're all so different. So I'm not teaching a recipe, like do this, this, and this in this exact way, because after all my years of medical practice, I know that won't work. So what I'm doing instead is providing a buffet and saying, here's a whole bunch of strategies to improve your sleep. Evaluate yourself first. So charting and self-awareness, just like Tessa explained, is really huge. And then based on your knowledge of where you're at and what your problems are, as you listen to all the videos in the course, hopefully you can identify which ones are potentially going to be the most helpful for you, and just focus in on trying those, and then work through each symptom area one by one. It's like a puzzle piece, and I kind of explain at first, you have no idea what the puzzle is, right? You have no pieces. And one by one, you add the pieces, and slowly the image kind of takes shape, and you go, oh, I get it. That the metaphor is, that's the body's innate healing system. So if we put enough, we can't cure ourselves, right? But if we put enough of the puzzle pieces in place, at some point, the hope is the body's innate healing system will go, oh, I get it. We're almost there. And it puts the last few pieces in for us. And I think that's what happened to me. You know, I had been doing this for decades, right? And going, oh, and then somehow I was just lucky. I got it right. And my body just took it from there.
Yeah, because that's the thing. The body doesn't want to be in a dysfunctional state. It wants to revert back to homeostasis, back to balance.
Yeah.
And it's just, there's these things blocking it. And if we can help to remove those blocks, then maybe the body can find its way back into homeostasis and back into balance, which, yeah, it sounds like it happened to you.
Tessa, very grateful.
I know, it's amazing. It really is. It's so good.
So, Eleanor, I do have one question before you go. As a practitioner who hasn't got any sort of chronic fatigue, I don't have ME, would it be useful for somebody like me to do one of your courses to learn more about it?
I think it would. I've had a lot of healthcare professionals and physicians take the course just to learn, you know, how to help their patients better. I think the beauty as a healthcare professional, you might not have to watch every video and every module, right? You could identify the patients that you're working with and the specific questions. It's all broken down into short videos, like 10 to 20 minutes each. So you could just watch the videos that you think are directly relevant. And then I have a ton of resources that would be extremely helpful for healthcare professionals. So I have like pages and pages of tips for, you know, each category of symptom. And then I have pages of resources. So websites, you know, YouTube videos explaining concepts. So those would be resources that if you like them, you could then recommend them to your patients. So I think it would be helpful.
Awesome. Cool.
Oh, and I have something just for healthcare professionals. It's called Alphabet Soup, because I refer to all these diseases by letters, right? Like CFS and FM and ME and all that. So I've called it Alphabet Soup, and it's free and any healthcare professional can join. I think it's not a publicly available link, so Fiona would have to put it in the show notes. Right now, I only have 3 videos on there. One is on pacing, actually. So it would just be kind of a review of some of what we talked about today. I've got one on long COVID and one on neuroplasticity. Those are the 3 videos that are up there right now. And hopefully I'll add more in the future as the demand is there.
Tessa, if you could give a health professional some key tips about helping a patient with any of these conditions. So as you mentioned, you deal with chronic fatigue, but specifically ME, long COVID or fibromyalgia, what would it be?
I think there's 2 big themes that I would really push. The first one we've sort of covered, which is validation. So when I'm speaking to a lot of people that we work with, they've had experiences in the past where they've felt the opposite of validated. So just, you know, providing that listening ear first and foremost, actually listening to them, not just pretending that you're listening, and just validating that what they're experiencing is, you know, the reality, and opposed to sort of just, you know, coming back straight away with solutions. First validate, and then the second one would be collaboration. So this was actually in the NICE guidelines as well, but it's something that every good practitioner should be doing anyway. But you're not telling somebody what to do, you're working with them to come up with the best solutions. So those 2 things together, validating and collaborating, I think are the 2 most important things you can do when working in this space in particular.
Absolutely, and particularly with people with ME who have been, I don't really like the term gaslit, but it was brought out a lot with long COVID. And, you know, people haven't been believed because it was thought of as a psychological condition. And so, yeah, just being heard is so important. And for the health professional to have that empathy and say, yeah, I understand you're experiencing this, you know, let's get to the bottom of it. Let's see what we can do. And and then collaborate, have that patient-centered focus. How can they work together, health professional and patient, to make it happen? Because a health professional can say, do this, this, and this, but if it doesn't feel right to the patient, then they're not going to do it, right? So it's working together to find that sweet spot. Ellie, what are your recommendations, do you think, for health professionals?
I think Tessa said it so well, because if you're truly listening to the patient and you happen to go down the wrong path, which of course happens, right? We're not perfect as healthcare professionals. The patient's going to go, you know what, that's not working. So I almost can't add anything to that, because if you're truly listening and collaborating with your patients, so this is for the healthcare professionals out there, you know, having been in the field for 35 years, patients have said to me, you don't have to know everything. I don't expect you to know everything. But as long as you're working with me, and, you know, often patients will be doing their own research and bringing it, and to be respectful of that. And if the patient says, this isn't feeling right, I think we're going down the wrong path, to really believe them, because you know what, patients know themselves better. So I can't add anything. That was perfect.
That's great. Well, thank you so much to both of you, Dr. Eleanor Stein and Tessa Nielsen, for being with us here today for this episode of No ME. It has been a really useful discussion, so thank you very much. I'll put in links to courses and information so that people can find out more. And we thank you both for providing us with your wealth of knowledge and expertise.
Thanks so much, Fiona.
You've been listening to or watching an episode of No ME, a place for you to hear the most up-to-date evidence-based information on ME. Thank you for joining us. Tune in next time for a deep dive into symptom management for people with severe ME.